Well, millions of Americans, including many in our area, now hoping they'll still be able to put food on the table come tomorrow.
It's a scary thought. The Trump administration says federal funding for food assistance will run out due to the month-long government shutdown. But a federal judge's ruling could press Washington to take emergency measures to feed those in need.
Pix 11's Justin Finch has more.
Good morning. And nonprofits like this Astoria Salvation Army are already working to feed families in need, but soon demand here and other spots could really grow with SNAP benefits now in jeopardy. Some are calling this a matter of life and death.
No SNAP benefits for me will mean I won't eat. Period blank. I won't eat breakfast, I won't eat lunch, and I won't eat dinner. I just won't eat. If I don't have a decent meal or resources to feed myself, I most likely will die because my health is already declining. Struggling in the city is not easy.
City resident Cindy Rivera saying hunger could very well end her life. Rivera joining a rally in Lower Manhattan demanding elected officials save funding for the country's Supplemental Nutrition Assistance Program, or SNAP. The U.S. Department of Agriculture is blaming congressional Democrats, saying they voted a dozen times against supporting SNAP, which feeds an estimated more than 40 million Americans monthly. Roughly 3 million are from New York State. In Boston, a federal judge is reviewing a legal challenge to SNAP's projected November 1st cutoff. New York AG Letitia James joining more than 24 states and Washington, D.C. to force the government to tap emergency funding to fill the gap as the government remains shut down. New York and New Jersey also turning to their own funding to feed families, but saying those dollars only stretch so far. Food assistance funding now on the line, as November 1st also means the start of open enrollment for healthcare premiums under the Affordable Health Care Act. Health policy research firm KFF forecasting prices will skyrocket, estimating a single adult in New York earning $50,000 a year would see their monthly $270 premium jump by more than $140. Experts saying many could feel the pinch.
These are folks who are most are paying nothing for their health insurance. There's about 1.7 million New Yorkers who receive their health insurance this way. Most pay nothing, some higher income, some they're still low income, but those who are on the higher end of the scale pay up to $20 a month. In the short term, those folks will see no impact. So this is really going to hit middle income New Yorkers pretty hard, the 140,000 or so on that state of health exchange.
And so, starting as soon as November 1st, hard times could really begin for so many, with SNAP benefits now in limbo, as well as healthcare premiums potentially rising for many due to expiring subsidies. Here in the city, Mayor Adams announcing some $15 million in emergency funding for food pantries and other providers to try and help those in the city get in their meals. In Astoria, Queens, Justin Finch, Pix 11 News. Back to you.